Hi friends, welcome to Infocular. Daily Dose series में आपका स्वागत है. We are up to part 3 now. We'll be dealing with 5 efficient NEET PG pattern MCQs today, and these are: which of the following is not an ovarian germ cell tumor? A. Polyembryoma, B. Teratoma, C. Dysgerminoma, and D. Endometrioid tumors. The answer is endometrioid tumors. Polyembryoma, teratoma, and dysgerminoma form into the category of ovarian germ cell tumors, whereas endometrioid is a part of the category of surface epithelial tumors. In case you want to retain this classification with a quick mnemonic, you can go ahead and look at the link that is mentioned below. The next question is, identify the pathological condition. आपको एक histopathology slide दी हुई है, which is in low power and a high power, and which is showing a pattern, a typical pattern, जिसमें एक clusters में situated हैं, and these have septations. Now this cluster of ball-like pattern is called Zell-Ballen pattern, with a double L on both sides. Zell-Ballen pattern, very important. And histopathology के slides जो है वो directly आजकल pictures में gross या histopathology slides आ जाते हैं to identify. So important patterns need to be retained. Zell-Ballen is an important pattern that you need to retain. And it is seen in conditions such as pheochromocytoma. Another condition is paraganglioma, and also seen in carotid body tumors. So in this question, our answer is carotid body tumor. This is a typical Zell-Ballen pattern. It is not seen in the other 3 that is mentioned in the options. The next question is, which of the following is a criteria useful to define severe acute malnutrition? A. Height for age, weight for age, and bilateral pitting edema. A pattern just to elongate the time duration. The options are none of the above, only 1, 2 and 3, all of the above. इस तरह के questions हमेशा time consuming होते हैं. So you have to figure out the answer right from the first step itself. यहीं से आपको start करना है before you even look at the options. Now, weight for height, height for age and bilateral pitting edema. इसमें से bilateral pitting edema and weight for height is used for severe acute malnutrition. Height for age कोई ऐसी specific criteria नहीं है for acute malnutrition. WHO define करती है less than 2 standard deviation of WHO standards is supposed to be called as severe acute malnutrition. So the answer is 2 and 3. Which of the following is most resistant to antiseptics? A. Spore, B. prion, C. cyst, and D. fungi. The answer is prions. Prions are the most resistant, and they cause diseases such as scrapie or Creutzfeldt-Jakob disease or chronic wasting disease. Less resistant criteria are gram-positive bacteria and enveloped viruses. So these 2 categories are actually more prone to antiseptics. So our answer here is prion. The next question is, which of the following represents a web-based program for monitoring tuberculosis? Many of you end up marking DOTS or RNTCP, or in fact Nishchay as well. We know that DOTS and RNTCP is associated with tuberculosis. This is therapy related and this is also the scheme related, but Nishchay is a web-based program. इसकी motive क्या है? It is based on 2 words, ni and kshay, which means eradication of TB, and this is a web-enabled application which provides universal access to TB patients. और इसको किसने launch किया है? Ministry of Health and Family Welfare. Central से launch हुई है ये. This is Nishchay. Sometimes people get confused with Nishchay, but this is for antenatal care. Do not confuse here. So that's about it for today's MCQs. Hope you like it. Keep following us. Happy reading!